My name is Sandra Ramirez, and I am a registered dental hygienist, and today I am here to provide you information about the different stages of your gum health and how to improve your oral hygiene. So you may be wondering, how do I know if my gums are healthy? Well, let me go ahead and show you an example of what healthy gums look like. We notice that the gums appear more pink and more firm, and there is no swelling present in between the teeth. A very important characteristic that is seen in the gingiva is that there is no bleeding present. When the dental hygienist goes and does the examination, there is also little calculus, which is also known as tartar buildup, little to no plaque, and also the probing depths, which is when we go in and measure your gum pockets, are 3 millimeters or less. If the patient does not have proper home care and the bacteria just stays in the mouth, it can progress to the first stage of periodontal disease, which is also known as gingivitis. Gingivitis is the inflammation of the gingival tissue. The gingiva begins to appear more red, and there is definitely swelling present in the gums. A main characteristic on gingivitis is that there is bleeding in the mouth, and the probing depths that we find are 4 millimeters or higher. But with gingivitis, there is no bone loss present, which means that gingivitis can be reversed. The way to reverse gingivitis is by removing that bacteria that is present in the mouth and by improving the home care that we will discuss on how to do at the end of this presentation, and continue to visit your dental hygienist or dentist. So in my next slide here, we see that plaque or bacteria that is present here is creating the gums to be more swollen, and it's also causing more redness around the gums. In this picture right here, compared to the healthy one, we start to see that there's more swelling in between the teeth, and the redness is around the gum margin right here. And if I were to go and do an exam on this patient, there's a high chance that they have pretty moderate bleeding around the mouth. So with gingivitis, we use our little periodontal probe, which we see here in this graph. We see that it is inserted into the gum pocket, and it stops right where the pocket ends. So we do see that there is more redness right here, and that there is no bone loss present. How do we know that there's no bone loss present? Because healthy bone should meet right where the crown and the root meet. So this right here is just inflammation around the teeth, which is reversible. If the bacteria is not removed in the mouth, it can progress to periodontitis. And periodontitis is how the body responds from the inflammation or infection that is already present in the mouth. It does happen after gingivitis, and the way periodontitis is diagnosed is that we start to see more deeper numbers around the teeth, and we also see bone loss present in our radiographs. So we see here in my chart that when we insert our instrument, we start to see deeper numbers in our instrument. And this picture shows right here that there has been some bone destruction, which is causing the gum to be more swollen and infected, and the gum is not healthy right now. So how do we treat periodontitis? Well, we treat periodontitis by doing a deep scaling, which just means that we go in deeper into the gum to remove the tartar buildup that has accumulated and start a maintenance program for the patient in order to get the gums back to healthy. The only thing with periodontitis is that any bone loss that is present cannot be grown back, meaning that periodontitis is irreversible. All we can do is stop it from getting any worse. So this right here, I'm going to show you some examples of radiographs. In this first radiograph, we see that the bone loss is not severe, but it is present. This right here is the bacteria that is below the gum line that needs to be removed in order to allow the gums to become more firm again and prevent and get rid of the bleeding and the swelling that is currently in the mouth with this patient. Will this patient lose any teeth? Most likely not, because the bone level is still pretty good range right here, but the patient must have proper oral hygiene and must continue to visit their dental team in order to prevent any more bone loss in the mouth. In the second radiograph right here, we see that the bone is more severe, the bone loss is more severe, and this tooth probably has some mobility. So it has a very poor prognosis. This picture right here shows you an idea of how the bacteria just mineralizes around the tooth and how the gum can become more red and swollen around the mouth. So how do we prevent the teeth from getting that severe stage of periodontal disease? So a very important thing is we must brush our teeth twice a day, morning and night, for 2 minutes. A very important thing is making sure that when you brush your teeth that you're angling 45 degrees into the gum line and doing back and forth motion. A very important invention that has come up in today's society that has definitely changed the dental industry is our power toothbrush, which we see right here is an example, a Sonicare. It doesn't matter if it's a Sonicare or an Oral-B, as long as you're trying a power toothbrush, it does help reduce that plaque in the mouth. A very important thing also is interdental cleaning, which would be like flossing. You can use your traditional floss, which we see here in this picture. We would do our C shape and go in between the teeth, up and down, or we could use our floss picks. Floss picks has been a very great invention because it is more convenient for the patient and it is very fast. As long as you're not just going up and down into the mouth and you're still going in and going in between the teeth, you are seeing more improvement by removing that plaque and bacteria in between the teeth. Another thing that is very helpful is mouth rinse. Any mouth rinse that is antiseptic helps prevent the inflammation from continuing because the bacteria is reduced in the mouth, which allows more time for the gums to heal within that time of the brushing and the flossing during the day. So if you have any questions about the different stages of your gum health or how to improve your oral hygiene, or even if you need help finding a good dental home, I know some patients have a little dental anxiety, which is completely fine. We are here to help you. We are not here to frighten you, and all we want is to improve your overall health because the health that is in the mouth is connected to our overall health. So it's very important to continue to take care of that health in the mouth. That way we can prevent any more diseases in the future. Thank you so much and have a wonderful day.